Welcome again to the Medical Terminology Podcast. This episode is Chapter 13, Part 2, Thyroid and Parathyroid Glands. Well, in this episode, we're going to cover two different glands. First part, we're going to cover the thyroid gland. The thyroid gland regulates metabolism. Metabolism is all of the processes involved in the body's use of nutrients. The thyroid also influences growth and the functioning of the nervous system. Let's begin by talking about the key secretions of the thyroid gland. The first one is thyroxine, thyroxine. Thyroxine regulates metabolism. The second secretion is triiodothyronine. That's a mouthful. Triiodothyronine. Triiodothyronine. Triiodothyronine also regulates metabolism. And finally, the thyroid secretes calcitonin, calcitonin. Calcitonin decreases the calcium levels in the blood by moving calcium into storage in the bones and the teeth. Well, then we have some pathologies associated with the thyroid gland. The first one is Hashimoto's thyroiditis. Capital Hashimoto', Hashimoto's thyroiditis. Thyroiditis. And this is the medical term for a specific condition. It's an autoimmune disorder in which cells of the thyroid gland are destroyed. Next, we have a general term, hypothyroidism. Hypothyroidism. And from the word parts, what would hypothyroidism mean? Well, hypothyroidism would seem to mean less than normal thyroid, or a condition of less than normal thyroid. And that basically is what it means. It's the general term for an underactive thyroid. It's a condition when the thyroid gland is not secreting enough. And the symptoms of hypothyroidism include fatigue, depression, sensitivity to cold, and a decreased metabolic rate, which makes sense since the key secretions, thyroxine and triiodothyronine, are there to regulate metabolism. Then we have two specific types of hypothyroidism. First, we have cretinism, Cretinism. Cretinism is a congenital hypothyroidism that results in arrested physical and mental development. And I hope you remember from way back in Chapter 2 that a disease that's congenital means you're born with it. So this would affect children, congenital hypothyroidism. Then we have a term for adult hypothyroidism, and that is myxedema, Myxedema, myxedema. That's adult hypothyroidism. Well, in addition to hypothyroidism, we also can have hyperthyroidism, Hyperthyroidism. And again, from the word parts, what would hyperthyroidism mean? Well, hyper, of course, means too much, and this would be the general term for excessive thyroid secretion. The thyroid gland is putting out too many thyroid hormones. And the symptoms of hyperthyroidism include increased metabolic rate, sweating, nervousness, and weight loss. Basically, the opposite of hypothyroidism. Then we have some terms for specific types of hyperthyroidism. First of all, we have a term for a rare, life-threatening condition of extreme hyperthyroidism. And this is known as thyroid storm. Thyroid and then storm. STORM. Again, a thyroid storm would be a rare situation where the body's suddenly just flooded with thyroid hormones. It's extreme hyperthyroidism and it can be life-threatening. The next term is Graves' disease, capital G, RAVE' disease. Graves' disease is an autoimmune disorder and it results in hyperthyroidism. The thyroid gland again puts out too much thyroid hormone. And Graves' disease has a couple of symptoms. The first one is goiter, Goiter. And goiter is somewhat old-fashioned term for an enlarged thyroid gland. It would be a swelling in the neck, basically. The other medical term for an enlarged thyroid gland would be what? Well, if we use the word parts and think about enlarged, that would be megaly, right? So an enlarged thyroid gland also could be thyromegaly. Thyromegaly. So thyromegaly or goiter is a symptom of Graves' disease, having too much thyroid flooding through the body. A second symptom is exophthalmos. 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 And that is an abnormal protrusion of the eyes. One has kind of a bug-eyed look. And again, that's associated with Graves' disease. Well, let's just review this much before we go on and talk about procedures. Identify the two thyroid hormones that regulate metabolism. Well, that's thyroxine, thyroxine, and triiodothyronine, triiodothyronine. And what is the thyroid hormone that decreases blood calcium levels by moving the calcium from the blood into storage in the bones and teeth? Well, that's calcitonin, Calcitonin. And what is the general term for an underactive thyroid gland? That's hypothyroidism. Hypothyroidism. And what is the term for excessive thyroid gland secretion? An overactive thyroid. That's hyperthyroidism. Hyperthyroidism. What is the term for a rare life-threatening condition of extreme hyperthyroidism? That's the thyroid storm. Thyroidstorm. And what is the term for the autoimmune disorder that results in hyperthyroidism? That's Graves' disease. Capital Grave', disease. And what is the term for an autoimmune disorder in which the cells of the thyroid gland are destroyed? And this would normally cause hypothyroidism. That's Hashimoto's thyroiditis. Capital Hashimoto thyroiditis, thyroiditis. What is the term for congenital hypothyroidism, which causes arrested physical and mental development? That's cretinism. Cretinism. And then finally, what is the term for adult hypothyroidism? That's myxedema. Myxedema. Okay, and now let's look at the procedures relating to the thyroid. We have three of them. The first one is a blood test that measures the blood levels of the thyroid stimulating hormone in the blood. And the term for this is thyroid stimulating hormone assay. THYROID hyphen STIMULATING hormone HORMONE and assay ASSAY. And again, this measures the blood level of the thyroid stimulating hormone. And which gland secretes the thyroid stimulating hormone? I hope you remembered that's the pituitary. The pituitary gland secretes the thyroid stimulating hormone, which in turn tells the thyroid to do its job of secreting thyroxine, triiodothyronine, or calcitonin. The next term is chemical thyroidectomy, CHEMICAL, then thyroidectomy, THYROIDECTOMY. A chemical thyroidectomy is the administration of radioactive iodine to destroy the thyroid gland. And this is a treatment for Graves' disease. If someone has Graves' disease, which again is a case of hyperthyroidism, excessive secretion caused by an autoimmune disorder, pretty much all they can do about it is shut down the thyroid completely by administering the radioactive iodine. This kills the thyroid, it quits secreting excessively, but then the patient will need to be on thyroid supplements to maintain a normal level for the remainder of his or her life. And finally, we have a lobectomy, LOBECTOMY. And a lobectomy is a surgical removal of one lobe of the thyroid. It could also refer to surgical removal of a lobe of a lung or a lobe of the brain. But in this context, it's going to refer to the thyroid. Okay, well, let's go ahead and go back over all of these terms we've covered so far. Number one, the condition of an underactive thyroid is known as what? That's hypothyroidism. HYPOTHYROIDISM. What is the term for an autoimmune disorder that results in hyperthyroidism, including symptoms of goiter and exophthalmos? Well, that's Graves' disease, capital G, RAVE apostrophe S, DISEASE. And what is the term for the thyroid hormone that decreases blood calcium levels? Calcitonin, CALCITONIN. What is the term for congenital hypothyroidism that results in arrested physical and mental development? Cretinism, CRETINISM. What is the term for a life-threatening condition of extreme hyperthyroidism? That's the thyroid storm, THYROIDSTORM. What is the term for the administration of radioactive iodine to destroy the thyroid gland? That's a chemical thyroidectomy, CHEMICALTHYROIDECTOMY. And what is the term for an enlarged thyroid gland? Well, the textbook gives us goiter, GOITER. We could also say thyromegaly, THYROMEGALY. And what is the term for the autoimmune disorder in which the cells of the thyroid gland are destroyed? That's Hashimoto's thyroiditis, capital HASHIMOTO apostrophe S, thyroiditis, THYROIDITIS. And what is one of the two thyroid hormones that regulate metabolism? Well, we have thyroxine, THYROXINE, and we also have triiodothyronine, TRIODOTHYRONINE. And finally, what is the term for the procedure that measures the blood levels of TSH? That's the thyroid-stimulating hormone assay, THYROID hyphen STIMULATING, hormone, and then assay, ASSAY. Okay, in part two, we're going to talk about the parathyroid glands. The parathyroid glands fit with the thyroid because the parathyroid glands regulate calcium levels. The parathyroid hormone increases calcium levels by mobilizing the release of calcium from storage in the bones and teeth. Notice that is the opposite function of the thyroid. The thyroid secretes calcitonin. Calcitonin decreases calcium levels by moving the calcium back into storage in the bones and teeth. So we have the yin and yang here that you have to keep track of. The thyroid secretes calcitonin, which decreases calcium levels. The parathyroid gland secretes the parathyroid hormone that increases calcium levels. Now, the only way I have to remember it, it may be a little goofy, I think of calcitonin as toning or tightening up the calcium. So that little silly mnemonic kind of helps me remember that calcitonin will decrease the calcium level by toning it, by tightening it up. Like you tighten up a muscle tone, I kind of have that image. It's tightening up the calcium levels. So if it's tightening them up, it's shrinking them, it's decreasing them. So calcitonin decreases calcium, parathyroid hormone increases calcium. Okay, and then we have a few pathologies related to the parathyroid gland, and these pretty much relate to what happens if the parathyroid hormone gets messed up. Okay, first of all, we have hyperparathyroidism. Hyperparathyroidism. From the word parts, what would hyperparathyroidism mean? Well, it's too much parathyroid hormone, right? Overproduction. Well, if we have overproduction of the parathyroid hormone, i.e., hyperparathyroidism, we're going to have some outcomes. The first one is we're going to have hypercalcemia, Hypercalcemia. And look at the word parts there, you ought to figure that one out. What is hypercalcemia? Well, that's too much calcium, hypercalci, and there's too much calcium in the blood. We've got the suffix emia referring to the blood. I hope you remember that one. Hypercalcemia, too much calcium in the blood. Well, that's going to be caused by too much parathyroid hormone because the parathyroid hormone increases calcium levels. We can have another condition related to that, osteitis fibrosa. Osteitis, osteitis, and then fibrosa, fibrosa. Well, this is a complication of the hyperparathyroidism in which the bones are softened and deformed. And that kind of makes sense, right? Because again, the parathyroid hormone increases calcium levels by stealing it from the bones and teeth. The bones and teeth store most of the calcium in the body. If the hormone tells the bones and teeth, hey, give up your calcium, and the calcium goes into the bloodstream, bones aren't going to have enough calcium, and so they're going to get soft and deformed. That's osteitis fibrosa. And then we have a treatment procedure for hyperparathyroidism. And pretty much what they do is a parathyroidectomy. Parathyroidectomy. And again, what would a parathyroidectomy be? Well, that would be the surgical removal of one or more of the parathyroid glands to correct hyperparathyroidism. Well, as you might guess, if we can have the overproduction of parathyroid hormone, we can also have the underproduction of parathyroid hormone. And what would be the term for the underproduction of parathyroid hormone? Well, that would be hypoparathyroidism. Hypoparathyroidism. Well, if we have hypoparathyroidism, that is not enough parathyroid hormone, What do you think the logical outcome would be? Well, the parathyroid hormone increases calcium levels, right? If we're not getting enough parathyroid hormone, we're probably not getting enough calcium in the blood. Too much is staying in the bones. So we would have too little calcium. And what would be the term for too little calcium in the blood? That would be hypocalcemia. Hypocalcemia. You'll notice here, like I pointed out in the first episode, a lot of this is understanding or thinking through the logic of the physiology. What are the causes and effects of too much, too little of something? The terms themselves are really pretty easy. They're following the word part rules. The tricky part is keeping track of what happens if there's too much or too little. And that all goes back to knowing what is the gland, what does it secrete, and what does the secretion do. From there, you can pretty much logic out what types of disorders are going to happen if there's too much or too little. That's certainly the case for the parathyroid gland. Okay, well, let's go ahead and do some review and practice with the parathyroid gland. Number one, what is the function of the parathyroid hormone? It increases calcium levels in the blood by mobilizing its release from storage in the bones and teeth. Now, what is the hormone that works counter to the parathyroid hormone? That again is calcitonin, Calcitonin, that tones or decreases the calcium levels. What condition results from hyperparathyroidism? Well, that would be hypercalcemia, Hypercalcemia. That would be too much calcium in the blood. And there is a condition that can result if we have too much calcium in the blood, not enough calcium in the bones where it belongs or where it gets stored. That is osteitis fibrosa. Osteitis, literally inflammation of a bone, right? And then fibrosa, Fibrosa. Well, what condition is going to cause hypocalcemia? Logic this through. Hypocalcemia, not enough calcium in the blood. That would mean there would not be enough parathyroid hormone. And if there's not enough parathyroid hormone, that would be hypoparathyroidism. Hypoparathyroidism. And finally, which endocrine gland secretes calcitonin? That is the thyroid gland. Thyroid gland. Gland. Okay, well, that covers it for the thyroid gland and the parathyroid glands. Again, you should work on these, get these down so that you understand them backwards and forwards. Continue to review the pituitary gland, and then once you've got those down, then you can go on to the next gland. This ends this episode of the Medical Terminology Podcast.